60,000 international unit formulation, which has to be given every week for 8 weeks, and then its maintenance dose has to be given each month. Now, I just want to emphasize more on the maintenance dose. What happens is patients take the vitamin D supplementation maybe for 6 to 8 weeks, and then they stop taking any maintenance dose. So what happens again is maybe in the matter of 1 or 2 months, again the vitamin D levels drops. So that is why the endocrine society, and again when he has to repeat the dosage for the same for another 8 weeks. So maintenance dose has to be given. Now, what you can do is sometimes this happens. I mean, I just want to know if this is the case in the institute, whether the patients are they are not taking the maintenance dose or they are okay with it.
So, depending on that factor, so please we repeat. We do that monitoring of the vitamin D levels.
But sometimes we have to be aware of vitamin D intoxication also. इतना नहीं दे दिया कि face
Ma'am, but toxicity is seen at very high levels. It is very.
Yeah, the thing is, as we know, as we have already discussed, around 80 to 90% of the population is vitamin D deficient, and you won't believe the levels are less than 50. I can actually guarantee that. Even if we all go to a vitamin D test, the levels are going to come maybe 10 or 11 like that. So, there have been guidelines which are said like until and unless you give a patient a dose of 10,000 international units per day, the patient is not going to show any symptoms of vitamin D toxicity. So, this is when you are giving, you have to be very cautious when you are giving vitamin D injections to the patient. So, if you are giving 3 lakh international units to any patient, then you are not supposed to give vitamin D supplementation for 3 months. And then ask the patient to get their levels checked, and then only you should ask the patient for any oral or intramuscular injections. And the same goes for 6 lakh international units. If 6 lakh has been given, then for another 6 months the patient is not supposed to take any vitamin D supplementation. Now this has happened in cases like what happens, sometimes the patient gets the injection, and maybe in some rural areas or where the patients are not that educated, the doctor doesn't let them know that this is something, that this is a vitamin D injection. We have just given it for the strength and all. They just say it like that. The next day what happens is the patient goes to some another doctor and he doesn't tell that doctor that I have been received the vitamin D supplementation. Again the doctor gives them the same injection or maybe the oral dose, and that's where the toxicity occurs. So there's a kind request to you, like whenever you're giving a patient any intramuscular injection for vitamin D, try to mention it on the over there in the prescription that you have been given this amount of dose of vitamin D. So be cautious whenever you're going to see some other doctor like that. So that actually reduces the chances of vitamin D toxicity. That's it. That we get. Nano formulation compared to that is quite expensive, but as we know the for liquid formulation, it's 4 bottles. Actually, it comes in high ml bottles. So there's like a packet of 4 bottles that come, which comes around in 260 or 250 rupees like that. So that's yeah, like that.
What is about the investigation? Then it will come deficiency है कि नहीं तो एक gap लगा के.
So what happens is usually, as I was also going to ask you, like whenever you are prescribing a patient with vitamin D, do you always ask for the patient to go for vitamin D test, or you just start with empirical supplementation? Exactly, test is like 14 or 1500, and considering the deficiency in the population, if you are giving that therapy, the therapy will mainly cost 400 rupees even for the whole 8 weeks. Right, so I think that is quite a good way, like if you can directly, that is not going to harm.
Why is there deficiency in society, and the investigation is very costly, treatment is very costly?
So that is what I'm saying, like 90% of the population is deficient. So it's better to just ask the vitamin D supplementation even if you're not going for the test.
Because very much deficiency.
Yes.
Test is very costly, and nanoparticle is very costly.